Welcome back to the second half hour of Fox 26 Morning News Extra. I'm Sabila Vargas.
Sue Wilson, for many couples, the idea of starting a family is an incredible step, but it might not be easy. So many people are turning to options to help make that dream a reality. Dr. George Grunert is with the Fertility Specialist of Houston, and we're so glad you're joining us here this morning. Let's just talk about how prevalent is this problem of infertility.
Well, estimates are that about 15% of all couples will have trouble getting pregnant, and that amounts to somewhere around 10 to 12 million couples in the United States on an annual basis.
And that's a fairly high number. I mean, it's pretty shocking to hear that. So a lot of people are seeking help. What are some of the first steps that people need to take if they're considering getting help from a doctor?
Well, the first thing is to really recognize that they have a problem. One of the things that we see is a problem with couples is a delay in seeking help. If they have been trying for pregnancy for a year, if they're under 35, or 6 months or over, if they're over 35, it's time to see their general OB-GYN. If they've been working with their general OB-GYN for 3 to 6 months and haven't had success, then it's time to see a specialist, a subspecialist called a reproductive endocrinologist.
So you go to you decide, I'm going to see a specialist, and once you do, what are some of the options that you're able to offer a couple in need of help?
Well, the main thing is to make a diagnosis of what the real problem is. We generally look at 4 areas. In order to get pregnant, somebody's got to ovulate. There has to be adequate sperm function to fertilize the eggs. There has to be a mechanical interface between the sperm and the eggs to be able to create an embryo. And the uterus has to be normal to allow the embryo to implant. So generally we look at 2 sets of problems. One is a specific identifiable problem, such as the woman doesn't ovulate. Another is a problem of subfertility, where things seem to be normal, but she's just not getting pregnant. And there we look at treatment options to increase the chance of pregnancy per cycle.
When you're trying to figure all of this out, it obviously takes the man and the woman to come in. And we all know that guys don't really like to go to the doctor very much. Do you have a hard time seeing some of these women dragging their husbands in, or are they pretty ready to have a baby so they'll come in no matter what?
Generally, it's not a problem. By that point, the couple's pretty well committed. And we find that in general that about 40 to 45% of the time there's a male factor or combined male and female factors. So it's very important in these couples to evaluate the men too.
Once you've decided what's going on with them and what the problem is, what are some of the options that you give them? IVF is certainly something we're always hearing about.
Well, IVF is certainly a treatment option. There are places where IVF is the first line of treatment. For most couples, IVF is a latter line of treatment. We generally try to use simpler, more economical, maybe more common sense treatments first. There are places where IVF is really the only option for some couples, but for most couples it's a secondary option.
It makes sense because it does cost people a lot of money, so they're going to really have to set aside insurance. Doesn't cover anything like this.
Well, probably in about 25 to 30% of couples, IVF is a covered benefit, but you're right, it is very expensive. But at some point in time, doing something that's more expensive, that's more efficacious, that actually works, is much more common sense than doing things that are less expensive that don't work.
It seems like in the medical field there's always something late breaking, always some new treatments coming about. Is there anything going on new in the fertility world? Well,
the things that we've seen come along recently with IVF, number one, is an increased ability to deal with couples with male factor infertility. Men with low sperm counts, men with low sperm function, even men with 0 sperm counts, where we can get sperm directly out of the testicles or the epididymis. We have a tool called ICSI where we can directly inject sperm into eggs. I think the second big revolution in IVF is genetic analysis of embryos. We have not only the ability to look at all the chromosomes in an embryo and tell which embryos do and don't have the ability to implant, but we now have an increased ability to screen couples for carrier status for genetic disease and then screen those embryos for fatal diseases. Even if the couple didn't know they were carriers, we can frequently pick that up before they do IVF.
Well, hopefully a lot of people will learn something from that and be able to take you up on that. Thank you so much, Dr. Grunert, for coming over from the Fertility Specialist of Houston. Very, very helpful information.
Well, thank you very much for having me.
We appreciate for all you do for couples here in the Houston area.